The state of Massachusetts has begun taking serious steps towards addressing the epidemic of opiate abuse and addiction taking place across the Commonwealth. Cheryl Bartlett, Commissioner of the State Board of Health, has been traveling to various communities conducting roundtable discussions with medical personnel and local politicians to start to figure out what steps can be taken to tackle this serious issue. Last week, Ms. Bartlett hosted one of those roundtables at Milford Regional, where a significant number of area medical experts, as well as Senator Moore and Representative Fernandez, were in attendance.
I'm here today at Milford Regional Hospital to have a community roundtable with community leaders, elected officials, clinical professionals to talk about the opioid overdose and use epidemic that we're experiencing not only here in Massachusetts but across the nation.
You know, here at Milford, we're very fortunate to have such great support from all the public service officials and safety officials and schools and all others that are concerned about this problem and have worked with us to do the best we can to deal with it. Clearly, there are still lots that can be done, and we're hoping that as a result of these discussions, we can suggest ideas and hear about ideas that'll make things better for the patients we're caring for.
This is about my 8th round table, going out and really trying to learn from the community what their concerns are and also what some of the innovative strategies they've implemented to try to address this epidemic. In Massachusetts, we've seen a 90% increase in opiate unintentional deaths over the past decade, and from 2011 to 12, about a 10% increase. And so that we really began to hear loud and clear from municipalities across the Commonwealth since particularly the beginning of the year that they were being recognized in all of our communities. So I think this has really started to hit every single community.
The passage of the medical so-called marijuana legislation, because it has apparently given, especially young people, but the public in general, the feeling, well, the drugs aren't that big a deal, that if marijuana is legalized, maybe it's not such a problem because it's not legalized federally, but it has affected a change in attitudes as to what's acceptable and what isn't to be taken, and that, I think, is going to contribute to a worsening and a more difficult aspect in trying to get people to stay away from the serious drugs unless they really need them for a terminal or very serious illness.
If you've ever been a part of a family that's dealt with addiction in your family history, and I have, it can be a very lonely and difficult place to be. There is an embarrassment. There's a difficulty to understand. It's not like a broken arm or a more traditional kind of an injury that's visible to you, that it isn't something somebody can just overcome. It's a terrible crisis. It's so easy to become addicted and so hard to break it. And that's the tragedy that strikes so many families. And when you lose that battle, particularly with young people who lose a child, it's something they never recover from.
It's a very frustrating experience for patients to get set up with the appropriate resources. I feel like the biggest, the best thing that we could do to help our patients is help them navigate that system.
There's a lack of residential treatments for females. There's only one female program that takes 13 to 18-year-olds, which is in Worcester as well, which is always an issue. There's always a waiting list. We need more adolescent female treatment out there.
It feels to me, maybe I'm just getting old, but it feels to me like 20 years ago, we had really robust peer education, evidence-based substance abuse prevention programming going on in the state of Massachusetts. And it was coordinated through our prevention centers at the time, working with schools, working with community-based organizations. And over time, those funds and the enthusiasm for it just dwindled away.
As the Commissioner of Public Health, the Governor declared a public health emergency in March, and that gives me emergency powers and prioritized this issue for me. So I'm really focused on working with communities to try to help them address this. We've had about a 90% increase in unintentional deaths from opioid overdoses. And so clearly this is a problem, and community solutions are really the answer.